So we're doing thoracic outlet syndrome interventions. I'm Jackson, this is Gabby.
So students will learn about the possible impairments that can lead to functional limitations with TOS. They'll also learn about the max, mod, and minimum protection interventions, via demonstrations, and then lastly, they should understand how these interventions would decrease the possible impairments.
So for the first impairment we're going to talk about is decreased range of motion in the scapulothoracic, the sternoclavicular, and glenohumeral joints. In typical thoracic outlet syndrome cases, most patients exhibit a decreased horizontal abduction, elevation of first rib, depression of clavicle, decreased cervical flexion, and decreased lateral side bending. This is typically due to tight anterior and middle scalenes, tight pec major and minor, and tight subclavius muscles. These muscles are considered the thoracic outlet closers. So when they're tight, you have compression of that thoracic outlet, which includes the subclavian vein, artery, and the brachial plexus. So you can have compression of one or maybe even all of these, depending on how severe the tightness and possibly other dysfunction we'll talk about later. But for the max protection phase, we've got two manipulations we'll do. One of them's a little familiar. So I'll do the pec minor stretch first. So you'll stabilize up here at the clavicle. And you'll apply resistance through the pec minor. Does that feel okay? And you'll do this to increase extensibility of the pec minor. But what you can also do is change some of your motions, maybe not necessarily in the pec minor direction, but you can kind of move around in this area because you've got pec major and you've got subclavius right there as well. So you can kind of shift your technique a little bit and work on some of those other muscles as well and work on those extensibility while you're in the same position. For the next one, I have you sitting up. The next one, the one on the left, is a first rib manipulation. For a lot of people, if these interventions, like if conservative interventions don't work, some people choose to have this rib removed. And some people, studies have shown they don't have it at all, the first rib. But in the case that they do have it, you can perform a manipulation where so what you'll have first, this one's a little awkward. I'm gonna lift, we're gonna pretend her right side is involved for this. We'll lift her arm up. We're going to move towards the side that she's having symptoms because we're gonna slack all these muscles on this side. And then what we're gonna do is find T1. The way you can do that, the spinous process of T1, you can find C7, the most prominent spinous process. You can ask her to forward bend and see that kind of protrusion out from the back and find C7 and just move down one spinous process. And right laterally to the transverse process of T1 is where you'll most often find the first rib. So I'm gonna shift you over again, or I'll make it this way. And what you can do once you're on the first rib, you can move it caudally, you can move it anteriorly, posteriorly, just wherever you kind of feel. You can do this as an examination technique first, maybe when they come in, and then this can be something that you would use as a treatment. All right, I'm gonna have you relax. So for the moderate protection phase, this first stretch, this is a particularly good stretch, this one, because once you get them in this position with the towel, I'm gonna wrap this over you. Can you take this hand behind your back and grab the back of this? that feel okay? And grab up here, and you'll just apply a downward pressure right here. So she can actually do this one at home, but what's so good about it is we're actually applying what we often apply when we're doing manipulations and assessing those joints and muscles. We're actually depressing possibly maybe that first rib, maybe the clavicle, maybe a little bit of the glenohumeral joint when we depress right here. And what we're doing is we're applying a stretch already before she even moves away from it to those scalene muscles, the SCM, possibly her upper trap. We're applying a stretch already when we place her in this position. But what I'm gonna have you do is just side bend to the opposite side of the towel. And she would hold for typically like 30 seconds. You can relax. So that would be stretching those muscles superior to the clavicle, the supraclavicular muscles that would include the scalenes, the SCM, upper trap. Then we'll find a good corner to do the cornered pec stretch. But this one's pretty basic. So we'll just have our patient rest their upper arm against the sides of the wall when they get in a corner, and just lean into it and stretch those pec major, pec minor, maybe even stretch a little bit of the subclavius muscle in this position. And you typically hold for about 30 seconds in this position as well. All right, good. You can go ahead. For the minimum protection phase, I have my patient in supine. I'm going to instruct her on how to do a chest fly. What's so good about this exercise is we're actually eccentrically strengthening. We're going to be focused on the eccentric portion of the chest fly. What's so good about this is we're strengthening those muscles that we've been working to get elongated and gain extensibility in for the first couple phases of the treatment. But now we're able to strengthen these muscles while also elongating them through the eccentric portion. So I'm going to have you right in front of you. You can bend your elbows as you go down and just slowly come all the way back and get a stretch in those chests. Good. You come back up. All the way down, get a good stretch. And up. You can progress this exercise by getting heavier weights, or just moving into some cable or maybe some heavy band chest flies, and just focusing again on that eccentric portion to elongate those muscles while strengthening them. For this last one, typically you do isometric exercises earlier on in treatment, but this is particularly good for the neck muscles because we can actually do these isometric exercises in different ranges throughout lateral side bending or flexion. So the PT could apply a force for the patient to give a counter force to do an isometric. You'd stabilize at the shoulder or the clavicular joint, AC joint. But you can also move them into slightly different ranges for them to perform these isometrics on. And you can progress this just by going into, you can make this a concentric motion if you do something similar to what Ebony and Jay Long did with the resistance band, doing some kind of band around the head and going concentrically and eccentrically, focusing on those motions.
All right. For the next impairment, we'll be talking about improper posture. So typically in TOS cases, you'll see forward rolled shoulders, forward head posture, and pressed clavicle and GH joint. It's typically due to symptoms that are associated with upper cross syndrome, which is altered muscle activation and movement patterns of the head, neck, and shoulders, where the muscles become tight and short and weak. So mainly in TOS, like Jackson said, we'll see the upper traps, CSM, and the levator scapula be pretty weak. So for the minimum protection phase, we can either do a supine pectoralis stretch on a foam roll, or we can do the stretches of the upper trap, levator scapulae, and the CSM. So for this demonstration, I'll just do the stretches. So I'll have him sit down in the chair. So for the first one, we'll pretend like his right side is his affected side. So I'll have him kind of tuck his chin in a little bit, and then side bend to that left side. And then he can pull it forward with that same arm, and that'll be stretching his upper traps. So maintaining that same position, he can rotate his chin down like he's looking at his knee, and that'll stretch the levator scapulae. So you should stretch back here. And then for the CSM, we'll point his chin up away. You should feel a stretch on the SC. Okay. Next, for the moderate protection phase, our goal is to now strengthen those muscles that we elongated. So we can either do the quadruped chin tucks, or we can do floor cobras. For this demonstration, I'll have him do it on the table, so you can lay on your stomach. So, with arms at either side of his body and the palms facing towards the ground, I will have him pinch his shoulder blades, and I can give him a little tap back cue. And he'll just hold that for 2 seconds, keeping his chin tucked in, just like that. Or you can do it in the alternative position where his arms are out in front of him. Just like that. Okay? And then lastly, for the minimum protection phase, we'll do IYTs and A's for the cobra position on the ball. And you can progress this to doing it with the weights now. So I'll have him lie on the lie on the exercise ball. So while holding the dumbbell in each hand, Jackson will lift his chest off the ball, keeping his back and neck in proper alignment. Next, he will extend his arms in front of his body and squeeze his glutes and squeeze his traps.
I can do it, awesome. I'm gonna slide down a little bit.
Okay. There we go. All right. Next, he can move his arms straight out, his thumbs up, and then out to the side of his body. And that would be the IYCTs. You can also do this position going straight back, just like we did on the plinth with the cobras. So for our last impairment, sensory impairments are also something that's typically a symptom of neurogenic TOS, where they can have altered sensation due to the compression of the brachial plexus. This can typically affect the affected arm and hand with tingling and numbness radiating down. So for the maximum protection phase, I will have Jackson do a median nerve block. So first, I will instruct him to abduct his arm out to about 90, flexing his elbow and extending his wrist. And then his head will be going the opposite direction. And then he'll move out, extending his elbow, keeping that wrist extended, and then his head will go towards his arm. We hold for a couple seconds in the back. And we'll do about 1 to 2 sets of this for 10 repetitions.
For the moderate protection phase, after a period of denervation and possibly some sensory impairments, some neuromuscular re-education is important to follow up after you've freed those nerves from the myofascial or the osseous structures that have been compressing them. So performing some PNF patterns, I know we've been hammering this down a bunch, but performing some PNF patterns of the shoulder are important. So we'll do D1 extension first, lead with the pinky, internally rotate, extend the elbow and the shoulder, and then you'll externally rotate to do D1 flexion. You'll go horizontal adduction, flexion of the shoulder, external rotation of the shoulder, and remain extended. A lot of people will also do elbow flexed at the top of that motion. And then D2 extension, internally rotate leading with the thumb back into the pocket area. You'll horizontally adduct, internally rotate, extend at the shoulder, and then externally rotate, horizontal abduct, regular adduction, coronal adduction, and go up to the top and extend, or flex, I meant. And then for the maximum protection phase, or the minimum protection phase, I'm sorry, doing some rhythmic stabilization exercises at the shoulder is important, because you want to strengthen those global muscles of the shoulder to ensure that you're getting proper alignment of the glenohumeral joint after we've worked the scapulothoracic and sternoclavicular joints so much that we've aligned them. We also need to focus on the shoulder, having proper alignment in the glenoid fossa. So performing some rhythmic stabilization. We'll do supine, arms straight out, and what we can do, you can instruct your patient to go into some slight abduction and adduction, horizontal abduction and adduction. And during this motion, you can progress to providing protuberations while she's doing it, and tell her to hold, maybe have her go into horizontal abduction and adduction for a period, and then telling her to hold and telling her not to let me move her. Just doing some rhythmic stabilization exercises of the shoulder in the minimum protection phase. All references. Y'all have any questions?
Okay, well, I know you said that doing the arms out was like an alternative for the cobras. Does that progress the exercise?
So, with the arm to the side, it doesn't really progress. It's more progressive when you have the